Hello students, in this video I will be discussing about the differences between pediatric and the adult larynx. This is one of the common questions to be asked in MBBS as well as MS, theory and practicals. Why is this important? Because pediatric larynx per se is more weaker and there are more chances of infection as well as more chances of congenital anomaly in pediatric larynx, and adult larynx is more or less more resistant to trauma as well as infections. First, coming to the level of pediatric larynx lies slightly high up at the level of C2 to C4, whereas adult larynx lies opposite to C3, C6. The advantage being the pediatric larynx has to move out. The pediatric larynx has to move up during breastfeeding. The child has to suck the breast milk of the mother. Therefore, it has to be in slightly higher level to avoid aspiration of breast milk. Therefore, it is possible for the child to suck the breast milk and to breathe subsequently. The shape of pediatric larynx is funnel shaped, whereas the adult larynx is column shaped. Therefore, the narrowest region of the pediatric larynx is subglottis as you go down, whereas in adult larynx, the narrowest region is the rhimaglottis or the glottis itself. The pediatric larynx is soft in consistency, whereas adult larynx is firm in consistency. The soft larynx in children is prone to edema by small infections as well as inflammations. As you know, acute supraglottitis, acute laryngotrichobronchitis are common in pediatric population than adult population, and they lead to respiratory distress, whereas in adults the infections less commonly lead to respiratory distress. The epiglottis in children is floppy and omega shaped, whereas in adults it is firm, flat and spade shaped. The problem in children may be laryngomalacia due to floppy and omega shaped larynx. The laryngeal structures, especially supraglottic structures, are sucked down when the child breathes in, so that leads to inspiratory stridor in laryngomalacia. The retainers are inclined inferiorly in children, whereas they are horizontal in the adult larynx, making more of the wide airway in adult populations. The glottis in children is concave and it's half of the cartilaginous structure only, whereas in adult larynx, the glottis is horizontal and it is 1/4 cartilaginous portion. It becomes more of the cord-like structure. As already told, the narrowest region in the pediatric larynx is subglottis, whereas narrowest region in the adult larynx is the rhimaglottis. So subglottic stenosis is common in children than in adults. If you like this video, please subscribe my channel, Dr. Krishna. Thank you.